Today we're going to talk about a new topic, very important. It's called ignoring or forgetting the disease names. See, we have thousands of different disease names. Hypertension, heart disease, Alzheimer's, Parkinson, diabetes, whatsoever, right? Well, since what we're coaching is a self-healing method, it's not a medical treatment, so we may say we're not really dealing with those diseases. What we're dealing with? Blockage. Where's the blockage? The blockage in the meridian. What is the meridian? Meridian is invisible to your eyes, but you can check it out with the equipment. It is a channel in which the energy moves, okay? Once it is blocked, see, once it is blocked, it is a dis-ease. So that's why it's also called disease. While we use the word blockage, that is more non-medical, okay? Basically, there are two big categories we can divide. If it is a simple pain problem, it's easy. Let's say I got frozen shoulders, the pain here, you can just do the slapping here. I got knee problem, low back problem, you can just slap on the knees, especially at the back of the knee, okay? While this is a simple issue, it is called simple pain problems. What about the other diseases names? What about especially the chronic diseases? See, we have so many different names for the chronic diseases. Yet, all these diseases, in spite of their names, okay? Parkinson, Alzheimer's, diabetes, even what? Even the anxiety or the depression problem, stress problem. All these problems have the same reason, the same cause, the same root. That is the blockage of meridians. So when we say it is a chronic disease, you got a name, right? Let's say, for example, okay, you got hypertension. People say, okay, I got high blood pressure, but I don't have a heart disease. How could that be? So I can assure you, once you got high blood pressure, that means your heart, at least on the heart meridian, you got blockages too. So I would say, when you are given the name hypertension, high blood pressure, or another name, lower blood pressure, that means you got blockages not only on your heart meridian, but also the meridians in your lungs, kidney, liver, spleen, bladder, gallbladder, etc. All of them, more or less, we have blockage. It's only a question of degree. While if you go to see a doctor, even going through all the check with the equipment, still you might get a chance that you cannot find out what problem exactly you have. The typical example would be, let's say, heart attack. We have experienced so many different heart attack issues. Let's say you think you're fine, but today you got a heart attack. Then you are carried, you're taken to the hospital. But sometimes, even in the hospital, you already have a heart attack, you feel you got very, very severe heart problems. With the machine, they can still not check it out. So even according to the statistics shown by professional medical journal, at least more than half of the heart attack, the sudden heart attack issues, they cannot check it out beforehand. What does that mean? See, when you have a heart attack, that means, let's say, assume, maybe that kind of blockage is over 50%. If it is below 50%, let's say the blockage is 20, 30 degrees, you still cannot feel anything. But there are already symptoms. Let's say if you, kind of tight at the chest, or if your heart beats too fast or too slow, or the beating is irregular. These are already the symptoms. But it's not a big deal for most of the people. You can still drive a car, you can still go to work in a normal way. But believe me, you already have blockage there. You don't have to wait until the blockage is over 50%, until the heart attack happens. So how do we do with that? Forget about disease names. See, let's say once you have a heart attack, or you get, let's say you get falling down because of fainting, at this moment, please forget about disease names. It's even more. You always do where? Here on both sides, okay? Because this is where the heart meridians go through. Whether it's because you get cancer, or got a Parkinson, or Alzheimer's, doesn't matter. Because that means your heart is blocked. Heart meridian is blocked. So no matter what names of diseases you have, you just do one thing for all the chronic diseases. You just do Paida on those general areas. That is the elbows, hands, knees, and feet. You just do them, okay? Because these so-called general areas basically cover the major 12 meridians. The major 12 meridians is like the freeway, highway in your body. So that kind of unblocking will happen. It's like scanning your body. See, we know MRI, right? MRI is equipment where they use the digitals to scan your body, right? But now, when you do the PaidaLajin, you are using your own chi or energy to scan your whole body. Wherever it is blocked, you will have symptoms. You will feel the numb, sore, and pain. So this kind of thing will happen in different parts of your body. It could be all over your body. It could be on the arms, on the legs, on your chest, on the hip, everywhere. So by doing so, you can see your blockages are so many, you cannot focus on just one meridian. For example, hypertension, okay? Most people would focus by taking medicine or any other methods to just lowering your blood pressure. So my question is, why do you focus on only lowering your blood pressure while ignoring all the other blockages, let's say in your liver, in your kidney, in your gallbladder, in your bladder, all this? So in one word, you just do what we call carpet bombing. We use another chapter to talk about carpet bombing. That is, you just do the whole forelimbs first, and then do the whole body. Because your body is simply full of meridians, full of the channels. It could be blocked everywhere, known or unknown to you. So the safest way is to forget about disease names, is just do the Paida and the Lajin. So much for today. Thank you for your watching.